Hello, good afternoon, everyone. On behalf of Dentium, I warmly welcome you all in today's webinar on simplifying implantology tips, tricks, and clinical pulse. This webinar will be informative and beneficial for those who are planning to start implant practices. We are privileged to have Dr. Avantika Tripathi, MDS Oral and Maxillofacial Surgery and Dentium KOL as our esteemed speaker, bringing expert technical knowledge and practical insights on the use of Dentium superline implants in the dental practice. We encourage all the participants to stay until the end of the session to avail webinar special packages and a chance to win one superline fixture in the lucky draw contest. So thank you for joining us. Thank you. And now over to Dr. Avantika.
Thank you, Mr. Subaru. Good afternoon, everyone. Welcome to today's webinar on tips, tricks, and clinical pearls in implantology using the help kit, refine kit, and prosthetic kit. So modern implant industry is not only about placing implants successfully, it is about simplifying the procedures, improving the precision, and managing the complications efficiently. So today we will discuss the practical surgical and prosthetic pearls that can make your implant workflow more predictable and stress-free. So today we will specifically focus on the help kit, which is helpful in managing the complications wisely. We are going to discuss about the refine kit, which helps in assisting the implant removal and bone graft harvesting. Apart from that, we are also going to discuss the prosthetic kit, which helps in making the prosthetic procedure, restorative procedure, more simplified. So these small clinical kits can significantly improve the long-term implant success rate. Starting with the refine kit. This is the refine kit. It has 8 drills which are available from the diameter 3 to 10 mm. It has an outer diameter and an inner diameter. Usually when we choose the drill, according to our case, we have to choose it according to the external diameter of the drill. So if we see the total thickness of this drill is 0.6 mm, as the internal diameter is 2.4 and the external one is 3 mm. Basically, this refine kit has 2 major roles. First is to remove any fractured implant, any failed implant which is nicely integrated inside the bone. So to remove that, we can take the help of these refine kits. Second role is to harvest the autogenous bone graft. With a minimal invasive approach, we can remove that small cortical plate along with some amount of cancellous bone with the help of these refine kits. So these are the refine kits which are available in different diameters. The diameters are chosen according to the requirement, available from 3 to 10 mm. If we can appreciate that the top surface which touches the bone is very, very sharp and aggressive. So it nicely goes inside the bone and creates a good amount of space in it. It engages very, very nicely. The markings available are 2, 4, 6, 8 and 10 mm. It is basically used to harvest the bone graft and to remove any failed or fractured implant. So to extract the bone graft, we place it. Suppose I need to remove it from the 3rd molar region, then I'm going to just place it on the buccal wall. I'm going to give an incision, reflect the flap. On the buccal wall, I am going to place it and I'm going to insert it at, usually when we extract the bone graft, we insert it at approx 4 to 6 mm, not more than that. So once it is inserted, then we are going to slightly check with a periosteal, mold curette or any instrument which you are comfortable with. We need to check whether the cut portion is properly separated from the adjacent bone or not. Once it is checked, then we are going to, once it is separated, then we are going to scoop it out with the help of any tweezer or tissue forceps. once it is completely separated. So this is a very delicate process. We should not forcefully remove this bone graft, otherwise the cancellous bone can get detached from the, or it can break also from the cortical plate. Once it is removed, then we can use it as a bone graft. As we all know that the autogenous bone graft is the best bone graft as it has osteogenic potential. So that is why with this drill we can extract the autogenous bone graft with a minimalistic approach. Coming to the use of Trifine kit for the removal of implant. Suppose I have to remove an implant, a fractured fixture of 5 mm, then I have to use the Trifine kit of 6 mm diameter. It has to be used in a clockwise direction of approx 600 to 800 rpm with copious irrigation. So it has to be seated in the direction of the implant placement. So we have to take an X-ray to check the direction of the implant, the orientation of the implant, and then the Trifine kit has to follow the same orientation. It has to go very gradually inside the bone. You should not forcefully push it. Once it is gone, we'll see the markings. If my implant is 10 mm, then it has to go at least 10 to 12 mm deep inside the bone. Once it has completely gone inside, then we are going to remove the drill. Sometimes, as in this case, we'll see that the fixture is picked up inside the Trifine kit, inside the hollow portion of the Trifine kit. As you can see, it causes very minimal damage to the surrounding bone, and if we have sufficient amount of bone available, we can place a thicker diameter implant also immediately if the bone is favorable to that. If not, we can fill that area with good amount of bone graft and we can delay implant placement. Next comes the prosthetic kit. Prosthetic kit is to solve all our prosthetic problems, or if we are putting any type of prosthetic component, we need to give a complete torque to that component. Now for that we need different type of drivers. If I am going to use a regular abutment like a dual abutment, milling abutment, angled metal casting abutment, that has to be tightened with the help of this torque ratchet driven hex driver, which is there in the prosthetic kit. If I feel like my patient's mouth opening is less and I need a and the hex driver which is there in the prosthetic, in the surgical kit is big enough and it is not going inside the patient's mouth, then we need a smaller size of hex driver. So I will be requiring this small hex driver. The total length is only 15 mm. And in the kit, there is also a long length of hex driver available for those cases. Suppose in the maxillary or in the mandibular anterior region, because of the chronic generalized periodontitis, the patient's adjacent teeth, there is a very huge amount of horizontal bone loss. So we need to give good size of crowns. So in case of 10 mm, 12 mm or even 13 mm crown heights, it is very difficult to work with a regular size hex driver. In those cases, we need to use a longer hex driver of 30 mm. Next, this is the this is the multi-unit adapter which has to be used with the handpiece. So if I am going to, like I showed you in the previous webinar, those who attended must be knowing that this torque ratchet, this handpiece adapter is used to tighten the multi-unit abutments. So we can set the torque in our ICT motor. For the multi-units, we usually give a torque of 35 NCM, 30 to 35 NCM. So we will set the torque of 30 to 35 NCM in the motor, and then we are going to tighten all the straight and angled multi-units. The angled ones has to be tightened with the help of the torque ratchet driven regular hex driver, because the screw in the angled multi-unit abutment is same as that of a regular abutment, like a dual abutment or metal casting abutment. This is the mini ball adapter. If I'm going to give my patient over dentures, then I have to give ball abutments to the patient. To tighten these ball abutments, we need a ball adapter. So this is used to give a final torque to the ball abutments. This is the multi-unit adapter which is used with the ratchet. So to give a final torque with the ratchet, we have to use this multi-unit adapter, and this is the torque wrench which is used to give the final torque to the prosthesis. So these are all the prosthetic components. Other than that, we also have a slot driver. Sometimes, in some cases, we feel like the slot of the healing abutments is the hex of the healing abutment is distorted, which means that my hex driver is not going inside properly. In those cases, I will use this slot driver. If you will see that there is a horizontal slot, a horizontal cut is there on top of the cover screw and healing abutments. The purpose of this slot is to engage the slot driver if your hex is distorted. In those, we can easily engage the slot driver. We can put the prosthetic driver over it. So this is the slot driver. I'm going to put a ratchet over it. I'm going to engage it in the slot which is there on the healing abutment, and I'm going to give a anti-clockwise direction. I'm going to rotate it in the anti-clockwise direction. So if it is properly engaged in the slot, it will move the healing abutment. It will loosen the healing abutment properly. Coming to the help kit. As its name says, whenever we are stuck because of any fractured screw, any fracture or distortion of the internal surface of the fixture, or any cover screw is broken, any healing abutment or any final abutment screw is broken, in those cases, this help kit will help us in removing or in solving those problems. We'll see how. This is a fixture remover driver. So basically, this fixture remover driver is rotated inside the fixture in the anti-clockwise direction, in the counterclockwise direction. Once it is properly engaged inside the fixture, then again we're going to put the ratchet over it, and we are going to give the torque in the rotated in the anti-clockwise direction, which will lead to removal of the fixture. But always make sure that a nicely osseointegrated implant cannot be removed by simply giving a anti-clockwise direction with the ratchet. If it is a partially integrated or a failed implant which is not integrated inside the bone, then we can remove it with the help kit, this implant drivers. Otherwise, if it is a nicely integrated implant and it got fractured, or it has a fractured screw which is not retrievable, or it is a failed implant for any reason, then we have to remove that implant with the help of a Trifine kit only. So by this we can remove the fixture. Now, after removal of the fixture from the patient's mouth, now I need to remove the fixture from this driver also. So to remove the fixture from the driver, I need to use the two ratchets. First ratchet is this one, which is available in the help kit, and the other ratchet is our regular ratchet, which is there in our surgical kit. So I am going to hold the fixture with this help kit ratchet. This this triangle, this flower like structure is there. So my implant will engage in this, and then I'm going to put my ratchet on the top of this driver, and I'm going to rotate it in the opposite direction. So this one has to be now, I'm going to rotate my driver in the clockwise direction, because initially I engaged the driver inside the implant in the anti-clockwise direction. So now I have to use a clockwise direction to disengage it. Once it is rotated, I will be able to separate the driver from the failed implant, and then my driver is ready to be used for the next case. So this is the help kit. These are the screw removers which are used for the removal of fractured screw. This is the tap repair. Sometimes the internal surface in the taper of the fixture gets distorted. So it is helpful in maintaining, in making of that taper, recreation of that taper. This is the abutment hex remover and the fixture remover. And these are the cover screw and abutment screw removers. So this is the fixture remover drill. As I said, it has to be rotated in the anti-clockwise direction. So I am going to first rotate it in the anti-clockwise direction to engage it with the fixture, and then I will keep on rotating it in the anti-clockwise direction till it brings the implant outside. A partially integrated or a failed implant can be easily removed with it. A nicely osseointegrated implant is difficult to remove with this process. Better to use a Trifine kit. Once it is removed, then we are going to remove this driver from the fixture. To remove the driver from the fixture, we need to hold the fixture with the driver, with the ratchet which is there in the help kit, and we are going to put the ratchet from the surgical kit on top of the driver, and we are going to give a rotation of clockwise. Once we are going to rotate it in the clockwise direction, it will disengage and it is going to come out. Next comes the cover and abutment screw removers. So these drivers are used when the hex of the cover screw or the abutment screw is distorted, which means that my hex driver with a hex of 1.28 mm is not seating, is not engaging on top of the cover screw or hex drive or healing abutment. In those cases, we can use the cover screw or abutment screw remover. So when the hex driver is not engaging, I am going to engage it again in the counterclockwise direction, and then I am going to remove it in the counterclockwise direction. For removal of the abutment screw, again, if the hex driver is not engaging, I am going to put the abutment screw remover or the cover screw remover in the anti-clockwise direction, and then I am going to again give the anti-clockwise direction and remove the screw. To the screw removers. Basically, the role of these screw removers is to remove any broken screw. So these screw removers have to be used at a slow speed of 30 to 50 rpm and in the anti-clockwise direction or counterclockwise direction with good amount of irrigation. So when for any reason the screw gets fractured inside the fixture, we need to use these screw removers in the counterclockwise direction. So they will create slight vibrations over the screw, and slowly they are going to disengage the screw and the screw is going to come out. Abutment hex removers are used to remove the hex portion of the abutment. Sometimes because of improper load or because of improper occlusal load, the abutment hex gets fractured. It is a very rare scenario, but if it is happening, we have a driver which is used to disengage this hex from the fixture and it is used to remove it. So we are going to put this abutment hex remover over the broken hex and we are going to put the ratchet over it and we are going to rotate it in the clockwise direction. Once it is rotated nicely, then we are going to twist it, disengage the hex from the internal hex of the fixture. Once it is rotated, we are going to give a movement, outside movement, and continuously keep on rotating it. It is going to disengage it and it is going to bring the hex outside. When the internal surface of the fixture is distorted because of excessive tightening of abutment, because of improper load with the time, the 11-degree internal taper is distorted. So for that, we can, if it is less distorted, we can recreate the internal 11-degree taper. How? By using the screw tap repair. So we are going to insert it inside the fixture. As we all know that superline has an 11-degree internal taper. So this screw tap repair is going to recreate that 11-degree taper if it is distorted somehow. So first we are going to seat this silver component over the fixture, and over that there is a hole on the top through which we are going to insert the driver in the clockwise direction. Once it is properly engaged, then we are going to disengage it in the anti-clockwise direction. When we will remove the screw tap repair, we will see that some portions of the fixture, we will see some particles of the fixture have shed under the fixture. So we are going to remove those particles with the suction. We'll clear the internal portion of the fixture and then we are going to place our final abutment. So this is the complete removal, this is the complete repairing of the internal surface of the fixture. So that's all about the help kit, refine kit and prosthetic kit. At last, I would like to conclude that these help kits, refine kits and prosthetic kits are not just accessory kits. Basically, they are clinical problem solving tools which helps in improving the precision, confidence of the clinician. So if I got stuck at any point with any sort of case, I can take the help of these accessory kits and I can make my procedure simple and easy to perform. So I'll give you one important clinical pearl that you should always remember, that successful implantology is not only about placing implants. It is about managing every stage carefully from planning to restoration and maintaining that phase properly. So thank you everyone for joining today's session. I hope these practical tips, tricks and clinical pearls will help you in your daily implant practice. Thank you so much.